Hello everyone, welcome back to Medinare. In this video, let's discuss about Varicella Zoster Virus, the causative agent of chickenpox. So let's begin. We've commonly heard of the disease chickenpox, right? So it is caused by the virus called Varicella Zoster Virus, but this doesn't end with this. It also has another clinical entity which is herpes zoster, which is also called as shingles, which will be dealt in another video. But let's concentrate on the Varicella zoster's infection, the chickenpox. As a detail of this Varicella zoster virus, it has got an official name called human herpes virus type 3, and so it's the common name, which is Varicella zoster virus. It belongs to alpha sum family, which has very short replicative cycle of about 12 to 48 hours, and these viruses have the tendency to cause latent infection. Weller was the first person to isolate this virus in human embryonic tissue culture. Also, Von Bocquet in the year 1889 suggested that varicella and herpes zoster are the manifestations of the same virus infection, which I mentioned earlier in this video, right? So both these manifestations are caused by a single virus called Varicella zoster virus, and therefore it is named so. So chickenpox is usually characterized by a generalized vesicular lesion, which occurs following a primary infection, which usually affects children. So you can't find that in older people, elder individuals. Whereas zoster, also known as shingles, occurs following the reactivation of the latent Varicella zoster virus. So this mainly occurs in adult life. So this virus enters a human body through upper respiratory mucosa or through conjunctiva. Once it enters the body, it replicates in the regional lymph nodes. Regional lymph nodes are those which are present near the site of entry of the virus. So once it reaches the regional lymph node, it replicates and it spills over and enters the bloodstream, which leads to primary viremia. The term viremia is nothing but virus present in the blood, right? Then once it reaches there, it reaches the liver and spleen, and it again enters the bloodstream, causing secondary viremia. So the blood is getting exposed to the virus for the second time. The virus in infected mononuclear cells are now transported to either skin, respiratory tract, or to the neurons. If it enters the skin, the virus replicates in the epithelial cells, which leads to development of the typical rashes that we see as a manifestation of the chickenpox. The swelling of the epithelial cells, ballooning degeneration, and accumulation of fluid in the formation of the vesicle will all happen if it reaches the skin. If it goes to the respiratory tract, the virus is shed in the respiratory secretions of the infected individuals. It will lead to transmission of this infection to other individuals while coughing, sneezing, etc. When it reaches the neurons, the Varicella zoster virus will gain access to the neurons of the trigeminal ganglia, and then there it undergoes latency. It stays there like it's staying in a house. Now let's move on to the clinical manifestations of this virus. This virus has got an incubation period of about 2 weeks, which ranges from 7 to 23 days. After this incubation period, the lesions begin to appear. The patient is considered to be infectious only during the 2 days, like before and 5 days after the onset of the lesion, right? So in children, they usually manifest with some prodromal symptoms like fever, malaise, etc. And they have the clinical skin lesions, which begin as a rash, and it shows multiple features, like multiple forms like macule, papule, vesicle, pustule, and its caps. So it is centripetal in nature, which means it usually starts on the face and the trunk, and then it spreads rapidly to involve all the flexor surfaces, but it usually spares the distal surfaces. But most commonly it manifests around the trunk region, and it also affects the superficial layer of the skin, giving it a dewdrop appearance as shown in this picture. As shown in this picture, the rashes appears as multiple crops in just 3 to 4 days, but this begin to crust within 2 days, which is 48 hours. So now let's talk about the complications of this virus. Basically, varicella zoster's complication won't occur in children, but it mostly occurs in adults and also in immunocompromised individuals. It presents as most commonly the secondary bacterial infection of the skin, usually staphylococcus infection. So the most common extracutaneous complication includes cerebral ataxia, encephalitis, aseptic meningitis. This can happen in children. Okay, and the most serious complication and the most important complication of this is varicella pneumonia, which develops more commonly in adults up to 20% of the cases. Also, it may lead to Reye syndrome, which can occur secondary to the infection. So in Reye syndrome, we can see fatty degeneration of liver following aspirin intake. Okay, then other complications include myocarditis, nephritis, and corneal lesions, and arthritis. So that brings us to the end of the part 1 of varicella zoster virus. The part 2 of the video will be exclusively about chickenpox in pregnancy, and in part 3 we'd get to see about the herpes zoster or shingles, and in the part 4 we learn about the treatment part of the varicella zoster virus. So it's a detailed video. It will be very helpful for you guys if you follow all the 4 parts. So don't miss any. Thank you for watching.